Hey guys, Francisco Wingard here, bringing you Module 7 uh, about an EMS topic. I'm going to show you guys how to use mnemonics when it comes to emergency medical services. There's a lot to know, there's a lot to memorize, so these mnemonics really help you out when things get a bit stressful, alright? The first one we're going to do, everybody knows, it's SAMPLE. The SAMPLE stands for signs and symptoms, allergies, medications, pertinent past medical history, last oral intake, and events leading to the situation. All right, that's going to be used on every single patient you come across, and that's going to help you write your SOAP. Your SOAP is the report, stands for subjective, objective, assessment, and the plan that you're going to put on to help your patient. All right, the next one I'm going to talk about is OPQRST. That is for anybody suffering from chest pain, abdominal pain, any kind of pain. All right, the O stands for onset, the P stands for provocation, the Q stands for the quality of the pain. The R stands for does the pain radiate anywhere? The S stands for severity on a scale of 1 through 10, 10 being the most painful. And the T stands for time. How long has this pain been going on for? All right, those are three great ones to memorize. The next one I'm going to talk about is vomit. That's for any type of call. Just a quick mnemonic. V stands for vitals, O is for oxygen, M is for monitoring on a 4-lead, I is for an IV, and the T is for transport. All right. Next one's going to be CON-FM. That's for your CHF protocol. So the C stands for CPAP, the O stands for oxygen, the N stands for nitro, the F stands for the furosemide Lasix, and the M is for morphine. All right, the next one, mnemonic, is going to be MONA. That's for any chest pain call. It's going to be morphine, oxygen, nitro, and aspirin. The next one is going to be for GOATS. This is for after any code. Quick, nice mnemonic to remember so you don't forget anything. So check a glucose, oxygen, antidysrhythmic if you haven't given it yet. You know, amiodarone, 150 milligrams in a 50 bag of D5W over 10 minutes. You have your temperature, get a temp, and also do your secondary assessment, which could be a 12 lead or a focused physical exam. The next mnemonic is DCAT BTLS. That's for any trauma patient. You're gonna look for deformities, contusions, abrasions, punctures, burns, tenderness, laceration, swelling. The next thing to know is our Glasgow Coma scale. That is very hard to remember. The way I remember, it's not the best mnemonic, but it works for me. It's every virgin moans 4, 5, 6 times. All right, so every is I response, and that is 4. So you got 4. You give them a 4 if their eyes open spontaneously. You give them a 3 if they open their eyes to verbal, a 2 for pain, and a 1 for no eye opening. The next one is virgin, or stands for verbal. That's 5 times. So 5 is orientated, 4 is confused, 3 is inappropriate words, 2 is incomprehensible words, and 1 is no verbal response. Next one is moans, which stands for motor response, and that is 6 times. So you got 6, they obey commands, 5, they localize the pain, 4, they withdraw from pain, 3 is flexion to pain, and 2 is extension from pain, and then 1 is no motor response. It's good to remember that anybody with a score at 12 or lower is a level 1 trauma alert. Big thing to know out in the field. All right, the next one I'm going to do is the KED. There's a ton of straps on there, so it's quite hard to remember, but if you remember this mnemonic, it's great. My baby looks hot tonight. My stands for the middle strap, baby bottom strap, L for legs, hot is for the head, and tonight is for the torso. All right, it's a great one to know, great one to remember. It's a test question used in a lot of interview situations, so my baby looks hot tonight. Very important. Let me think here, another good one. Let's see, sludge is another great one used for organophosphate poisoning. S is for salivation, L is for lacrimation. U is for urination. D is for defecation. G is for gastrointestinal upset. And E is for emesis. There is one more that we were using that I forgot. Oh, this one, I don't know if it's still in effect, but I learned it in primary school. It's called NABLE. That's for all the drugs that could be put down the ET tube during a code. So you got N is for your Narcan, A is for atropine, V is for vasopressor, E is for epinephrine, and L is for lidocaine. Alright, and those are some mnemonics that can be used out in the field to help guide you in your process. Hope I've informed you on my EMS topic. You guys have a great day. Take care.